Patientory is an award-winning digital health data wallet that allows users to control and monetize their data using AI to connect them with opportunities to improve their health. All right, hi everyone. I'm Chrissa McFarlane, founder and CEO of Patientory, and I'm here to help all of us maximize our health. Patientory is an award-winning digital health data wallet that allows users to control and monetize their data using AI to connect them with opportunities to improve their health. Barriers to technology adoption, such as HIPAA regulations, drive up costs, which is a problem that inhibits access to great quality care. It costs the US and Europe over $300 billion to provide healthcare to its citizens. Healthcare is expensive, the second largest expense in this country, and it's not leading to better outcomes. It creates exploitation and used by data brokers that make over $250 billion a year selling our information. So data is a backbone to providing quality healthcare, and lack of access to this is an impediment. Currently, data is siloed in medical record systems, making it hard for patients to access and healthcare organizations to fully understand their patient population. This $10 trillion industry, which only has access to about 20% of unlocked data, when unlocked fully, can drive tremendous value across the healthcare continuum. This is needed now more than ever, especially with recent regulations that push for patients to have control of their data. So imagine owning all of your healthcare information at your fingertips to understand areas you can improve your health based on your own health information. You can simply download our app, verify your identity, and our algorithms match your electronic health data to your Patientory digital health data wallet. Storage is free, and you can also subscribe to a freemium plan, which gives you access to an AI-driven digital health coach offering you daily recommendations to improve your health. Patients are in the driver's seat of this information, making it easy to consent to share information with providers that has access to our enterprise analytics dashboard. We target providers, pharma employers, and payers in creating a holistic, patient-driven data exchange ecosystem. This HIPAA-compliant system is also placed on a secure, decentralized health information exchange network, which represents over 24,000 health systems. Privacy and security is at the forefront of our technology, ensuring that we all have the capabilities to optimize our health. This drives our competitive advantage in the industry as we're poised to take advantages of new emerging technologies such as generative AI and machine learning to improve individuals' health based on their own data. Our traction includes notable investments from GSK and Novartis and a $1.5 million oversubscribed pre-seed round with over 50,000 subscribers, 15 pharma clients, which rely on our network for clinical trial recruitment. We also recently launched a partnership in the pharma space as well with Mark Cuban Cost Plus Drugs, ensuring that our network is able to identify current medications that users use and recommend the most cost-effective drugs for them. Our app is also actively reviewed by influential health and wellness influencers that use this app on a daily basis. My background particularly is in emergent healthcare technology, which after seeing challenges in telemedicine space inspired me to start Patientory and tackle interoperability. Our CTO has over 15 years experience building enterprise analytics systems, and our advisors are all senior executives in healthcare from former CEOs of health systems and payer organizations. In our next round of funding, this will enable our team to grow our revenues with outstanding committed contracts from our 15 pharma clients that we found product market fit with. We're currently raising $5 million seed to scale and expand out of R&D into commercialization with 60 organizations in our pipeline, leading us to a growth round in 18 to 24 months. So join us on our transformative mission in democratizing access to patient data to improve cost and outcomes. Thank you.
Chrissa, well done. You packed a lot of information into a short period of time. One of the questions that I have is you're dealing with a few different cutting edge technologies around artificial intelligence and blockchain, right? How do you manage that on your product roadmap?
Yeah, it has been a challenge, more on the team side because we are so deep in deep tech and research in healthcare, especially being a small startup company. But we've been able to get around that and partner in, especially internationally, with leading technologists as well. But for most part, we were able to successfully build out our proprietary blockchain network, which I mentioned connects to 90% of health hospital systems today through various partnerships and federal and state partnerships that we have to be able to, provide our consumers and users access to their data.
I think I saw you flash it on the previous page, but just for clarity, like how many subscribers do you expect with this next round of fundraising?
Yeah, we're expecting over 1 million. We do have a signed contract with Clear at the airports as they look to expand into other use cases for identity. The beauty of this is, a person never has to, really identify who they are by using this type of system. We use a universal patient identifier, which is verified through the use of a patient's identity. So we currently use ID.me, Clear, which in our next round we would go live with and really, expand it out to their 23 million plus user base as well.
Chrissa, I love the fact that you've been able to basically create a national patient identifier for your system, but we haven't done it for the country yet. I think that's pretty innovative. Some questions from the audience. How do you reach your individual patients? How do you recruit them to the platform? How does that work?
Yeah, previously it was all organic, from doing podcasts, showcases like this, we were able to get a really healthy community following of people. We started out with over 3,000 people that found us over the past couple of years. Since then, I mentioned our influencers. They've been pretty active across different social media platforms in really just helping get the Patientory brand and name out there.
Chrissa, it seems like one of the things that you're really doing is putting control of patient data back in the patient's hands, or at least access to their own data. How does that fit into your broader mission? It's considered one of the holy grails of healthcare, right?
Yeah. And our whole mission in democratizing information. And where we really found product market fit was even through the pandemic when we worked with Moderna and they were going through their phase 3 and couldn't really get a hold of underrepresented or people that weren't represented in those clinical trials, right? So being able to have I would say, platform that can expand globally, right? With people owning their data. It now boils down to, I'm an individual, my health matters. And, there are therapeutics that are out there that now can be reachable to me, which wasn't in the past available.
Yeah, no, that's great. We have one final question from the audience, and then we'll let you go. Who is your biggest competition?
Good question. And I know I hinted on this early on, and I really wanted to really boil this down is, when we look at it from a business perspective, we are competing with data brokers. They're the ones who monopolize the market today. They're the ones who are making money from the sale of our data, which we can't even, sell or be able to monetize at all.